we're looking at IT solutions that really provide the best care and best care for the patient. So it's really around patient-centred health. And some of the things we're doing are things like patient queue management systems to really help the patient not have to wait so long queuing for appointments and actually automate the process to get them to the pods where they need to go. Other things we're doing, things like intelligent patient journey systems. And that's really about understanding where the patient is along their journey within the inpatient and helping the doctors and the nurses to know really the status of the patient and what they need to do to the patient. And linked in with that is what we're calling access glance. So that's really for the bed managers to know the status of all the different patients are and working out who's going to be discharged first and really making it more efficient so the patient actually can flow not into the hospital as well, but also out and be discharged as quickly as possible. And other things we're doing are things like intelligent cardiovascular information systems. So that's really for the cardiologists and helping them to report and to be able to have some smart clinical decision support to enable them to treat their patients better. Queue management kiosk, the sort of strategy behind it, originally when they designed the building for the acute services building, which is basically an inpatient wards and also outpatient clinics at the bottom, was to really reduce the amount of waiting areas. So traditionally in a hospital you have a big reception, patients go there, then they might be sent off to pods. And to prevent that sort of build-up of all patients gathering waiting at reception, we actually had as part of the project is to have these patient queue management system with kiosks. So really what the patient can do was to go to the kiosk, they can self-check in, they can work out where their pod is they need to go, and so they can move straight to the pod without having large gatherings of patients. So that's really more efficient for them, and you're really making the waiting areas for the pod a lot smaller as well too. The actual use of the kiosks was a bit of a change because people aren't actually used to having kiosks within a hospital. And so what's happened is that we've actually had to use volunteers to actually help the patients get used to it. So sometimes you can get elderly patients, etc., and they're not quite used to using these new technology. But we found that we're actually sort of slowly growing in the rate of their use because waiting at a kiosk is so much faster because there's many of them than waiting at reception. So we're finding now we've sort of risen to about 50% of use, a little bit over 50% of actually using the kiosk. And the other advantage of the kiosk is actually got a number of languages built in so that patients can actually answer the questions and check in their own language. So that's been quite good. So it's probably a bit over 1.5% that are using foreign language or languages apart from English. IT is really interesting because usually the technology is actually pretty good and actually works quite well, but the hardest thing is actually the change management. And it's not just the change management for patients because a lot of the technology is actually used by clinicians. And if you're used to doing, you're treating your patients in the way that you've been doing it for hundreds and hundreds of years, which is on paper, it's quite hard to actually change to electronic systems. So our biggest challenge is really around change management in terms of assisting the clinicians, the doctors, the nurses and allied health staff, etc., to be able to use the new technology. And we find that even when you put the new technology in, most people only use a very small percentage of it. And so it's an ongoing challenge to actually understand the technology, understand the workflows, and actually helping the staff and the users to actually get the most out of that technology. Western Health is very similar to a lot of hospitals around Australia. We're still very heavily reliant on paper. So even though we've got what we call a digital medical record, they're sort of scanning paper to actually make it electronic for actually clinicians to use. To remove that paper would be fantastic. So a lot of hospitals are moving towards what's called an electronic medical record. And if we can get to that electronic medical record, that would just really streamline a lot of the processes, really help with reducing errors, making sure that the records are available to all the clinicians anywhere, anytime, and even outside of the hospital as well too. So there's some of the things that we're doing. We're also looking at better ways of improving workflow for the patients. Things like normal appointment bookings were quite isolated or quite siloed in the way that we make bookings. So you could book a radiology appointment, someone else could book an outpatient clinic, someone could book, say, a fracture clinic, and each of those appointments are not related. And so what ends up happening is the patient could end up coming 3 separate times for a patient visit. Wouldn't it be great if the patient could actually, from the GP, actually work out when they can make those appointments, actually book them all at the same time, and if they change one appointment, they can actually change all of their appointments. They're all hooked together. And they're the kind of things that we're investigating and hopefully being able to implement in the future.